For 15 years, Michael Raymond kept Australia's fighter jets in the air as an Air Force technician.
Seeing them take off and witnessing that on the daily reminded me of how lucky I was to be around these amazing aircraft.
But in 2011, Michael's luck nearly ran out on a US Air Force flight from Hawaii.
We lost the right engine as we had just taken off. So it blew turbines through the engine and it started exploding. Some of the crew were calling their wives and telling them that, I don't think I'm going to make it home, honey. There was a lot going through my mind, actually. The fact that I may not see my family again. And yeah, it was a lot of time to contemplate your own potential death, I suppose.
Eventually, the plane made an emergency landing. But over the years, Michael went into a tailspin of his own.
It seemed to feel like there was this pressure building up. It was harder and harder to keep a lid on things. It was a very dark place. And something I didn't know I could come back from.
In 2018, he was medically discharged from the Air Force with post-traumatic stress disorder. Michael underwent psychotherapy and was prescribed antidepressants.
But in the end, yeah, they weren't working for me.
Michael and his then partner started looking at an obscure alternative. He booked into a retreat using traditional psychedelic therapies in the mountains of Peru.
And, you know, I had breakfast with the people on the retreat and I just was cracking jokes and laughing and felt... And then they looked at me and they said, "We didn't know you were this funny."
Right now, the use of psychedelic substances is prohibited in Australia. But while we might see them as illegal party drugs, they've been used in traditional treatments for centuries.
There was no way I could believe it until I'd experienced it myself. And it was so powerful. It's like I'd taken off these scratched, dirty set of sunglasses and I could see clearly again.
Dr. Stuart Saker is a veteran and psychiatrist who specialises in post-traumatic stress disorder, or PTSD. In 2008, he trained in psychedelic-assisted therapy in Israel.
What the medication seems to do is turn off the part of the brain which is interpreting the world as a threatening environment. And that's how people heal.
Psychedelic therapy involves using drugs like MDMA and psilocybin, the active ingredient in magic mushrooms, to treat mental health problems, especially PTSD.
These treatments are extremely safe, and these treatments don't lead to addiction, treatments don't lead to death or serious morbidity. PTSD
is a condition that's stubbornly hard to treat. Only 5% of sufferers go into remission using drugs, including antidepressants. But 67% of patients in one research trial achieved that result using psychedelic-assisted therapy.
When you look at the research that's being done on the application of psychedelic substances to try and deal with mental health issues, you have to be pretty impressed.
Admiral Chris Barrie ran the Defence Force from 1998 to 2002. But he says it's not just veterans who could benefit. PTSD affects more than 1 in 10 Aussies.
Up till 2019 at least, there were 1 million Australians whose lives were affected by post-traumatic stress disorder. We think that figure has gone through the roof as a consequence of the Black Summer of bushfires and, frankly, from the COVID pandemic.
Dr. Saker wants the law changed so he and other psychiatrists can administer the treatment in a clinical setting.
We could be doing that treatment tomorrow if we were allowed to, and three out of 4 of you would be not having those conditions after we were finished that treatment.
The controversy still surrounds the treatment.
There is a promise in this research for treatment of depression and PTSD and a number of other conditions, but there is still but further research which needs to happen before they can, their restrictions can be reduced.
Right now, Australia's Therapeutic Goods Administration is considering rescheduling both psilocybin and MDMA. If that happens, they could be used by psychiatrists but wouldn't be available for patients to use at home.
There is emerging evidence of potential therapeutic benefit in the treatment of mental illnesses such as PTSD and depression. However, the benefits and risks of such use are still currently under investigation.
If we roll this out and we do it properly, there will be less veteran suicides. And if we take a long time before we roll this out, there's going to be more veteran suicides. It's a pretty tragic situation, and I'm looking for the best solution, and I think that this is it.
If we've got this amazing tool to put in our toolbox to help mental health, that could have such an immediate effect on people's mental health, why are we getting in the way of it?
Wow. God, people are amazing, aren't they? The things they think of. That said, I mean, we've sort of backed into the use of it now for medical reasons, haven't we? Because that's how it started.
Yeah, that's an interesting point, actually.
Isn't it? Yeah. That now that we've sort of come full circle with it, we're also, ooh, drugs.
Yeah.
But if this is showing good results,
Yeah.
we owe it to our veterans to at least continue to go down this path until...
Yeah.
And to the party people of Australia.
I think you just set the pause back about 5 years.
But that's like, they've known that all along, Waleed.
No, sure.
You know?
Yeah. Look, I think you trust the process here, right? The TGA, like, it's not like it's a unanimous position that this is the way to go, but they're clearly going to look at it, and you just hope
well,
that
they have to try something. But then if you think back as well, what about the days when Coca-Cola used to have cocaine in it?
Are you just interested in parties? Is that what's happening?
No, but I just find our thinking odd, how we suddenly, like, we put 4 letters in a row and go, you can't say them.
Yeah.
Do you know what I mean? Like, we invent these drugs and then go, no, you can't take them.
It's going to be a big 7 days at Cape House over the next 7 days. But I think how we treat our veterans says a lot about us as a country, and I think this has to be explored a lot more.
Yeah, absolutely.
And also, Pete, I mean, the suicide rate amongst returned veterans is 18 times the rest of the community. So we've got to find an answer for them.
There's no doubt about that. Well, the full statement from the TGA is available on our website if you want to check it out.